Well, in our previous session, we discussed up to the various types of contraception, and today we'll discuss MTP, that is medical termination of pregnancy, then STD, sexually transmitted disease. It is also known as STI, that is sexually transmitted infections, and ART, assisted reproductive technology. So let us start with the topic medical termination of pregnancy. The first topic is medical termination of pregnancy. So, termination of pregnancy without consultation of a doctor or physician is illegal. But there are certain cases under which the pregnancy can be terminated, and that is called medical termination of pregnancy, and this is done before the full term, and this is the intentional termination. But it doesn't mean that a person can take the decision of his own. At any time the termination will be done, so that will be illegal. Okay, so we'll discuss under what condition this termination of pregnancy can be done, and how it is legalized in India, when it was legalized, and the Amendment Act also will discuss. So let me first tell you the definition. It is the intentional termination of pregnancy before full term. Okay, and it is also called induced abortion. Okay, so these two terms you have to remember. The short form of medical termination of pregnancy is MTP. This is MTP. Okay, now this process or MTP is legalized in India. It was legalized in India in 1971. Very, very important. Okay, now let us see the Amendment Act that was done in 2017. So, MTP Amendment Act 2017. So, according to this act, what were the amendments? The amendment, it includes: first, pregnancy can be terminated up to 12 weeks. Okay, and at least opinion of one doctor must be taken. Okay, so up to 12 weeks means it is the first trimester. In the first trimester only this can be aborted, so that it will be safer for the mother. Otherwise, beyond which it may prove fatal for the mother. So it is not suggested after 12 weeks or the first trimester. Okay, and it should always be done under the supervision of the doctor and after taking the opinion of one doctor. Okay, under what condition it is suggested, that we'll discuss what is the reason. So the next point is if it extends from, if it is during 12 to 24 weeks, then opinion of minimum at least two doctors must be taken. Okay, so these are the amendment done in 2017. Okay, now reason for MTP. Under what condition the MTP is legalized? So let me tell you reasons for MTP. So under what condition it will be, or what is the reason for MTP? The first one is unwanted pregnancy. Unwanted pregnancy means if the mother is pregnant and it was found that the fetus is having some genetic disorder, okay, then with the suggestion of the doctor, the pregnancy can be aborted. So that is unwanted pregnancy. And besides that, if the contraceptive is not taken in time or on time, and under that condition, if the female is pregnant, then that becomes unwanted. So they can take the opinion of the doctor and they can abort the child. Okay, then the next one is failure of contraceptives. So suppose say the couples have taken the contraceptives, but it failed. So in that case also, because they have taken all sorts of effort to prevent the contraception, but it is failed because of some reason. So under that condition also, the MTP can be suggested. Then third one is in case of rape. Then when the pregnancy is danger to dangerous to mother. Okay, and last one is if the fetus is abnormal. Under these conditions only the MTP can be suggested by the doctors. Otherwise, in all other condition MTP is illegal. Okay, now sometimes people also undergo illegal abortions without consulting the doctors, and there are certain risks of these illegal abortions. Let us see what are the risks of illegal abortions. Risks of illegal abortion. So first one is it is unsafe. Undergoing abortion at any time without the consultation of doctor is unsafe for the mother. Okay, and most of the time it is fatal. It may cause death of the mother, and generally it is not performed by the doctors. So it is performed by inexperienced person, that is performed by the quacks. It is performed by the quarks. And the quarks may or may not take the responsibility of any harm that is caused to the mother. So these are the risks of illegal abortions. The next topic is our sexually transmitted infections. So next topic is sexually transmitted infections. That is STIs. Okay. So this is also called venereal disease. Sorry, the spelling is wrong. Venereal disease. Okay. 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 The short form is VD. And it is also known as RTI, reproductive tract infection. RTI. This full form you have to remember. Now, what are the common STIs? So often the examples of some STIs are asked. So whatever examples are given in your textbook, that only I am giving you. So the first one is gonorrhea, syphilis, then chlamydiasis, then genital herpes, genital warts, trichomoniasis, uh, hepatitis B, HIV, AIDS. So these are the examples given in your textbook. Now, how these infections are transmitted from one person to another person. So the transmission of STIs. So it is transmitted through sexual intercourse. So that's why the to avoid this, the most important method of contraception is the barrier method. So next, sharing the needles, of infected person, then infected blood transfusion, and it can be transmitted from mother to fetus. From mother to fetus. So these are the mode of transmission of STIs. Now, the most important thing where you do the mistake is the symptoms of STI or STD and complication of STDs. So many of you get confused between these two. So be very clear about this. The symptoms and complications are two different things. Okay. Now let me first tell you symptoms. So symptoms are seen in the initial phase. Okay, and symptoms of STIs or STDs also you can write. So these are seen in the initial stage, but the chronic symptoms leads to some complications. So the complications and symptoms are totally different. So if the symptoms are seen, then it can be curable. It can be cured, but once it leads to the complications, it is very difficult to cure. Okay, so let me first tell you what are the symptoms. The symptom includes itching, swelling, pain, and fluid discharge. So all these are in the reproductive system. So these are the symptoms which are seen during the initial phase of infection. Now it leads to complications. If it is not treated, then it becomes complications. Now come to complications of STDs. So if after the appearance of symptoms, the infection is not cured, then it may lead to following complications. Okay, so now let me tell you the complications. The complication includes pelvic inflammatory, disease, that is PID. This abbreviation you have to remember. Then it may lead to, so the first one is pelvic inflammatory disease. So pelvis may undergo swelling or inflammation. The next one is it may lead to infertility. Then it may lead to abortion, unwanted abortion. Fourth one is stillbirth. Stillbirth means birth of a dead child, dead baby. Okay, so now fifth one is ectopic pregnancy. So what is ectopic pregnancy? Ectopic pregnancy, you know that the pregnancy starts with the implantation of the embryo. So the pregnancy takes place when the embryo is implanted in the uterus. Okay. But sometimes what happens due to this STI, the embryo is implanted somewhere else other than uterus. So implantation of embryo other than uterus. And uterus is highly contractile, so the fetus can grow up to its full term. But when it will be implanted in some other part, and basically it is implanted in the oviduct. But oviduct is not that much contractile, so it leads to stillbirth. Okay, and this creates complication for the mother, and sometimes it is fatal for both the fetus and the mother. So this is called ectopic pregnancy. Very, very important. This stillbirth is also very important. The next one is reproductive tract cancer. Any part of the reproductive tract, and in case of female, mostly the cervix is affected and it leads to cervical cancers. Okay. Now, what are the steps to be adopted to prevent these STIs? So, prevention of STIs. The first, avoid multiple partners. Then number two, use condom. So I have already told you that condom is the only contraceptive, only barrier method by which the STI can be prevented. Okay, because the female and male reproductive fluid will not come in direct contact with each other. Then early diagnosis is highly essential, and if it is diagnosed at the early stage, means when the symptoms are seen, then it can be cured. And in case of appearance of the system, consultation with doctors. Okay, so if the symptoms appear, then a person must consult the doctor and go for going for complete treatment. It is not like that ki you have taken the medicine for few days and you left it. So you have to ensure that this disease or infection is completely removed or completely cured. ओके, जैसे हम बोलते हैं ना, जड़ से उखाड़ देना, तो जड़ से उखाड़ देना चाहिए. ठीक है. नाउ कम टू द नेक्स्ट टॉपिक, इनफर्टिलिटी. So what is infertility? It is the inability to produce children despite unprotected intercourse. Means the couple have not taken any contraceptive and they have done the intercourse maybe continuously, but still then they are unable to produce the children, or unable to conceive, then it is known as infertility. And in your summary, a time period is given, that is 2 years. Okay, till 2 years if they are not able to conceive, the female is not able to conceive, then that is known as infertility. But infertility is not only it is subjected to the female only, the males are also infertile. Okay, so now let us see what are the causes of infertility. So this infertility, the causes includes, there may be some physical defect in both male and female. There may be some congenital disorders. Any one of them is having some genetic disorder or any disorder since birth. Okay. Then third one is any diseases like some infections, as we discussed earlier in the STIs. Then sometimes the effect of drugs, as a side effect of drugs also, the infertility appears. Then psychological factors, it is the most important factor, because many of your functions of the body are regulated by your psychology. Okay, so this is one of the most important factor. The next is immunological factors. So if the female or male, any one of them are not having efficient immune system, in that case they will be prone to the diseases, infections. So in that case the chronic diseases may lead to infertility. But this is not the end for them, because the modern technology has have technologies have opened the doors for them, and that doors are the assisted reproductive technology. So now let us see what are assisted reproductive technology. So these are the boon for the infertile couple. Okay, so what are the different types of technologies? Let me discuss. The first one is IVF, that is in vitro fertilization. In vitro fertilization means fertilization outside the body, means in the lab the fertilization is done artificially. Okay, excuse me. So this is also called test tube baby program. Okay, so now after fertilization there are different options for this. After fertilization, the embryo is transferred to the female reproductive tract in different stages at different places. Now, let us see the embryo transfer method. The embryo up to 8 cell stages, the embryo can be developed in the laboratory in the test tube, but beyond that, it may not be, uh, that is, you can say, it may be harmful. So that's why the embryo transfer methods are there. So now, embryo transfer methods. So this includes ZIFT, GIFT, that is zygote intrafallopian transfer. ओके, देखो बच्चों, यहाँ पर आप बहुत कंफ्यूज हो जाते हो, जिफ्ट का गिफ्ट में लिख देते हो, आईयूटी में लिख देते हो. सो यू आर डूइंग लॉट्स ऑफ मिस्टेक, यू गेट कंफ्यूज्ड. यहाँ मैं एक ट्रिक आपको बता रही हूँ. देखो, ये जो जिफ्ट है, ZIFT, यू मस्ट नो द फुल फॉर्म. ओके, सो जाइगोट इंट्राफैलोपियन ट्रांसफर, मतलब हम किसको ट्रांसफर कर रहे हैं? जाइगोट को. या तो फिर किसको कर रहे हैं? द एम्ब्रियो अप टू 8 ब्लास्टोमियर स्टेज. लेकिन ये 8 ब्लास्टोमियर नेचुरली कहां पर होता है? इज इट इन द यूटेरस? नो, it is in the isthmus of the fallopian tube. So if you remember, the here is the zygote is formed. This is zygote. The zygote undergoes cleavage, and when it reaches this portion, that is isthmus, it becomes 8 ब्लास्टोमियर स्टेज, जिसको हम बोलते हैं बोरूला. ओके, सो ये कहां पर इम्प्लांट किया जाता है? इट इज ऑलरेडी गिवन इन द abbreviation, that is fallopian tube. Okay, so here the embryo, very very important, with up to 8 blastomeres transferred into fallopian tube. So here two things most important: 8 blastomere stays and implanted in the fallopian tube. Now the next one is IUT, that is intrauterine transfer. Okay, so if it is 8 blastomere, then it is implanted in the fallopian tube, and that too isthmus. Now if the blastomeres are more than 8 blastomeres, then it is transferred to the uterus, because in the uterus, when the blastomeres are 16 to 32 cell stays, it is known as blastocyst, and the blastocyst is implanted in the uterus. That you should have in your mind. So here, embryo with more than 8 blastomeres transferred into uterus, so that it can be implanted in the uterus. So here what you have to remember: more than 8 blastomere stays and transferred, because the definition itself says IUT, intrauterine transfer, means it must be implanted in the uterus. And you have to remember that in which stage the embryo reaches the uterus and implanted. Then next we will discuss another transfer system, not transfer, that is another art, that is GIFT, that is gift. Okay, its full form is gamete intrafallopian transfer. So here what has happened? Suppose say one female is so these conditions you have to understand. These mostly these questions that is these are the case based questions. Okay, case based and conceptual questions. So here nowhere here in book it is given that under what condition such type of transfer will be done. But listen me carefully. This is the, let me first tell you, this is ovum is transferred into another female's fallopian tube. What do you think? Under what condition the ovum of one female would have been that is would have been transferred to the fallopian tube of other female, and and where can you say it is in the ampulla, because ovum is transferred, it is not from the zygote. So ampulla में ये आपका transfer होगा. But can you say under what condition? The condition here I am giving you one condition and you think of other condition. If the female is the first female who is the donor, who donates the egg, able to produce ovum, but do not have capacity to conceive, means there may be some problem in the uterus, there may be some hormonal imbalance, because of which the female can produce the ovum but it cannot she will not be able to conceive. Okay, in that case the ovum is taken from this female and it is implanted in the fallopian tube of the other people, so that is recipient. The recipient is often known as surrogate mother, but it leads to many legal complications. Okay, on the later stage, in the later stage, the second mother claims the baby. So there are so many legal procedures for this. Okay, and the next one is ICSI, that is intracytoplasmic sperm injection. So what do you mean by this? Intracytoplasmic sperm injection means here the sperms are collected from the well and directly injected into the cytoplasm of the ovum. So here the sperm is directly injected in the ovum. So it is also, it is sure that it is taking place in the lab. So healthy sperm is collected, healthy ovum is collected, and then by the modern technology, the sperm is directly injected into the ovum. Okay. The next is artificial insemination. All of you know about this, very well aware about this. So here semen is introduced artificially into the female reproductive tract. Okay, so this is called AI. This AI generally, it is generally in a vagina, but it may also take place in uterus, that is intrauterine transfer, to increase the chance of fertilization. The sperms may directly be injected into the uterus. Now, there are certain problems with the art. Problems with art means assisted reproductive technology. So, what are the problems? It is very expensive and it always requires experts. So if the experts are not there, it is not done with the help of experts, then what will happen? You have spent a lots of money for this, but ultimately it fails. Okay. So that's why experts are required. Then it leads to may lead to emotional and social issue. So as I said, in case of Europe, like which one? Gift. मान लो एक गिफ्ट का केस लेते हैं. गिफ्ट में क्या होता है आपका? वन मदर डोनेट्स द ओवम टू द अदर मदर एंड हु कंसीव्स एंड वो लिखा पढ़ी हो जाता है कोर्ट में कि बच्चा पैदा करने के बाद द सेकेंड मदर विल हैंड ओवर द चाइल्ड टू द बेबी टू द फर्स्ट मदर. ओके, बट ऑफन ये क्या होता है आपका, एक तो है देखो, मदर का एक इमोशन डेवलप हो जाता है व्हेन सी कंसीव्स एंड उसका एक अटैचमेंट हो जाता है बेबी के साथ एंड नाउ दैट मदर इज नॉट रेडी टू हैंड ओवर द बेबी टू द फर्स्ट मदर. Okay, so the first mother, that also affects the emotion of the first mother. Next, how it leads to social issues. अभी देखो किसी मदर ने कंसीव किया एंड नाउ आफ्टर कंसेप्शन, आफ्टर चाइल्ड बर्थ, सी हैंड्स ओवर द बेबी टू द फर्स्ट मदर. देन सोसाइटी में एक बात होती है कि अरे इसका तो बच्चा नहीं था. So from here let me start because it was due to network issue, it was skipped. uh, so artificial insemination, the semen is introduced artificially into the female reproductive tract, but generally reproductive tract means it is injected into the vagina, but there is also option to increase the chance of fertility. It is intrauterine transfer. Then there are certain problems with art. This art, these technologies, modern technologies are very expensive and it requires experts. Suppose you have uh, uh, taken decision to adopt any of the art and you have spent lots of money, but the expert is not there, then your money will be wasted and it may lead to emotional and social issue. So how it leads to emotional and social issue, let me tell you. In case of gift, where the gamete is donated by one mother to the another mother. ओवम जब हम एक मदर से दूसरे मदर को डोनेट किया जाता है तो वहां पर लीगलाइजेशन किया जाता है, कोर्ट में पेपर बनाया जाता है कि द फर्स्ट मदर का जो ओवम वो दे रही है सेकेंड मदर को, तो सेकेंड मदर आफ्टर कंसेप्शन, आफ्टर द चाइल्ड बर्थ, सी हैज टू हैंड ओवर द बेबी टू द फर्स्ट मदर. बट ये क्या होता है आपका, जब बेबी को कैरी करता है मदर तो उसमें एक इमोशनल अटैचमेंट हो जाता है, एंड नाउ दैट मदर इज नॉट रेडी टू हैंड ओवर द बेबी टू द फर्स्ट मदर. Okay, this is one thing, and this also affects the emotion of the first mother. The second one is social issue, how it leads to social issue. The social issue arises. सपोज से मान लो कि आपने फर्स्ट मदर, द डोनर मदर हैज गिवन द ओवम टू द सेकेंड मदर. ओके, एंड द सेकेंड मदर इज कंसीव्ड. नाउ दैट बेबी who has taken birth is now identified as the baby of the second mother, not of the first mother by the society. So when that second mother hands over the baby to the first mother, the society raise fingers at the first mother that she is not the original mother of that baby. Either she might have been adopted the child. Okay, so that creates a social issue. Then these technologies are not available everywhere, so everybody is not accessible to these technologies. But however, there is another option for these couples that is adoption. So it is a legal method for children, a childless couple. Excuse me. And it helps the orphan children. But it is nowadays it is not so simple process. It requires lots of proceedings, legal proceedings. And however, this is one of the option for the. So with this, your third chapter is over, and I hope it is very much clear to you. Please note down the points I have given, and the important points, give more stress to these points. And I have given all the points from the NCERT only, nowhere else. Not a single line is left. Excuse me, I'm not feeling well today. So get ready with your notes, and please go through the chapters, go through my notes, and in the next session I'm going to give you the previous year questions from this chapter. So till then, bye bye, thank you.